Welcome back. First reported in 2016, the deadly fungus Candida auris is now causing concern for health professionals across the United States. The CDC describes the fungus as a type of yeast causing severe illness in hospitalized patients. Joining me to discuss the fungal infection is Dr. Roy Gulick, Chief of Infectious Diseases at Weill Cornell Medicine and NewYork-Presbyterian. Doctor, thank you so much for joining me.
Sure, pleasure to be here.
Now, can you give us an overview of the deadly fungus Candida auris?
Sure, there are four types of microorganisms that cause disease in humans. There are bacteria, viruses, parasites, and then fungi. Candida auris is an example of one of those fungi. So the name Candida auris, Candida is the family name, and we have lots of other Candidas that have been known for years. Auris is this particular species name. And what everyone should know about Candida auris is that it's actually new. It was first discovered in 2009 in Japan, and this was a fungus that was isolated from a patient's ear. So ear can translate roughly as auris, and that's how it got the name as Candida auris. So this is a fungal infection that is passed from person to person. The first case, as I mentioned, was in Japan in 2009, but it began to spread internationally. So cases were described in Asia, in Africa, in Europe, and then South America. The first US cases were described in 2016, but actually dated back to 2013. So there were a handful of cases seen between those years. And the first cases in the United States were really localized to the New York and Chicago area. But since that time, since 2016, and particularly in the last 3 years, we've seen increasing cases of Candida across the United States. Currently, cases have been reported from 29 states and the District of Columbia.
Now, can you just explain how the actual infection spreads? So, is it through sneezing, is it through touching? Like, how does it actually spread from person to person?
So Candida auris is an infection that is associated with healthcare facilities. It's not the kind of infection that's spread in the community. And it is spread by direct contact. So someone who has typically Candida auris on their skin, and that's not unusual. All of us have bacteria and fungus on our skin, but someone who comes into contact with Candida auris could pick it up and it would be transmitted directly by skin-to-skin contact.
Now, what are the symptoms of this infection?
So if a person has Candida auris on their skin, it can just live there and not cause any disease at all. However, if there's a wound in the skin, so a break in the skin, Candida auris, among other bacteria and fungi, can actually infect the wound and cause a wound infection. It can also cause ear infections, such as the case I mentioned from Japan. But the most serious infection is when Candida auris gets into the bloodstream and then can really infect the entire body.
Now, I want to add, as somebody who enjoys media, like there's a recent show called The Last of Us that kind of, it sounds very similar to this. Now, I'm sure it's not anywhere as severe as that, of course, but, could you just talk about how the infection actually affects your body and your overall health?
Again, when you have it on the skin, it really may have no effect at all. If it infects a wound or the ear, that could cause drainage, and again, could be treated with topical agents that are just put right on the wound or inside the ear. But the most serious infections that Candida auris causes are when it enters the bloodstream. That becomes a total body illness and can result in fevers, sweats, and in the most severe cases, even drops in blood pressure, and it can be life-threatening in those cases.
Now, I want to talk about that. This is kind of happening during a time where we were just recently experiencing COVID, and in many ways we still are. How does this differ from that? So how do you know, okay, this is one thing and COVID was another, or any of the other, infections that have been going around or spreading around lately?
Sure. Well, one thing they have in common is that they are both fairly new diseases. Of course, COVID is caused by a virus, and a virus that's spread most commonly through the air, and so was passing from person to person in the community to a large extent. Candida auris as a fungus is different. So it's spread, as I mentioned, from skin to skin contact. And really important to know that all of the Candida auris infections that have been described are people in healthcare facilities. So this is not spread through the air, and it's actually not common in the regular community right now. It really affects people who are in healthcare facilities, specifically long-term care facilities, such as rehab centers and nursing homes. And it particularly affects people who have devices, so tubes, or maybe on a ventilator long term. Those are the kind of patients who are becoming colonized with Candida auris, meaning it's living on their skin, and in some cases, true infection with Candida auris.
Now, I kind of want to expand on that because I wanted to know who was most at risk. Now, I understand it's patients, but does somebody with pre-existing conditions, are they maybe more at risk than just another patient who just happened to be in the area?
So clearly, it is about people who are inpatients in healthcare facilities. And again, not so much hospitals or acute care facilities, but more long term care facilities like nursing homes and rehab centers. That's primarily the group we're seeing. Of course, people in those centers can have acute problems and are often transferred to regular hospitals. And that's where we're seeing Candida auris really expanding. It's when patients who are colonized with the organism develop complications and then are transferred to an acute care hospital. So that probably is one of the reasons why it has been spreading in recent years. A second reason is what we just talked about, COVID-19. So during the pandemic, lots of resources were really focused on COVID, and some of the preventive measures that can help contain infections in hospitals and in rehab and nursing homes were slackened a bit because people were so concentrating on the COVID pandemic.
Now, as you mentioned, both of these viruses, well, they're not both viruses, but the virus and the infection are fairly new. Can you just explain how that has affected, research efforts? And I understand that the CDC reported that it was difficult to identify the fungus with standard laboratory methods. Can you just explain why that may be, and if this is like a really huge challenge in regards to healthcare?
Sure. When someone has an infection from a microorganism, what we typically do is take a sample. It could be blood, it could be sputum, it could be a swab from a wound, and we send it to the microbiology lab, and they have tests that they do to determine, well, what is the causative organism, and what is its name, and what kind of therapies would be active against that organism. So in the case of Candida auris, the older tests may have misidentified it. Candida auris was new. Some of the old tests would identify it as one of the older candidas that we've known for many years. And therefore, the detection of this organism was quite challenging. Newer techniques that many labs have now employed can identify Candida auris, certainly. And so that's led to more appreciation that Candida auris could have been out there and simply not been detected with the older tests that we used.
Now, I understand that there are reports that Candida auris is drug resistant. Can you explain what that means?
Sure. So again, Candida auris is a fungus, and we have specific treatments for fungal infections, and we call them antifungals. Makes sense. There are three broad classes of antifungals that we might use. And in the case of Candida auris, it has a natural resistance to 2 out of 3 of the major classes. That distinguishes it, particularly among Candida. Other Candidas are typically susceptible, so we could use either of those 2 classes. The third remaining class is called echinocandin, and that would be the treatment of choice if someone had Candida auris. What's been more concerning recently is some Candida auris, and I want to emphasize it's a small number, less than 5%, but still out there, have developed resistance to that third class. So not only are they resistant to the other two, but now the class that we turn to routinely for Candida auris, we're beginning to see an increase in resistance to that third class of drugs, the echinocandins.
Now, I want to kind of go back to something because you mentioned okay, it's drug resistant. So can you just explain the difference between, an infection versus a virus? Because I think that's why a lot of people are sometimes nervous about, hearing oh, this is, drug resistant, or, this doesn't work on that. Can you just explain the difference between the two and why, they're going to affect your body differently, which means there are going to be different treatments for it?
Sure. So there's a couple of points in there, I think, to talk about. The first is something is called a colonizer if it's just present but not causing infection. So what do I mean by that? I mentioned before that every human being on their skin has bacteria and may have fungus on their skin. Also, inside of our mouths or inside of our intestines, we have bacteria, we may have fungi, we may have viruses in our system, but they're simply living there. We call them colonizers. They're just living but not causing disease. When something changes, sometimes these microorganisms can enter the body. In the most serious cases, enter the bloodstream. And then we have a truly established infection. And of course, that needs to be treated. People get sick. They'll have fevers, chills, those kind of symptoms, may feel systemically sick, just not well. So we have different treatments to turn to for different classes of organisms. People are familiar with antibiotics to treat bacterial infections. More recently, antivirals to treat viral infections. We have drugs to treat parasites. And for fungi, we have antifungals. Now, whenever we use any of these drugs, there is a chance that the microorganism, the bacteria, the virus, the parasite, or the fungus can become resistant to the treatment, meaning that the microorganism somehow has changed and the treatment is no longer effective. And we call that drug resistance. What we're seeing really across the boards with all kinds of organisms is an increase in drug resistance. And Candida auris is a good example of a microorganism that not only had native resistance, but is developing more resistance to the common drugs that we use.
Well, doctor, I want to thank you so much for joining us to talk about this. I definitely learned a lot, and I feel like I have a lot more to learn, but I truly appreciate you taking the time to speak with us.
Sure, happy to be here. Thanks for having me.
To learn more about this developing fungus, please go to CDC website, which is displayed on the screen below. We've come to the end of our show today. I'd like to thank all of our guests for joining us and you, the viewers, for tuning in. If you missed any part of today's show, you can catch the recable cast at 5 and 10 p.m. on Optimum Channel 67 and Verizon Fios Channel 33, or watch anytime on the web at bronxnet.org. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.